Good afternoon, Sabina.
Good afternoon.
Good afternoon, everyone. Thank you for being here. We have a few updates at the top, and then we'll open it up for questions. And I want to start by talking about our state's COVID response. Yesterday, I put out a video speaking directly to everybody in Rhode Island, and I want to thank the news outlets for amplifying the message to all our residents in the state of Rhode Island. We're seeing an increase in the number of COVID-19 positive cases here in Rhode Island, but we expected that with the cold weather, and we're watching it very carefully. My team and I are in direct contact with our partners and colleagues at the Department of Health, and we meet regularly with our whole government response team, which also includes representatives from the Lieutenant Governor's Office, Commerce, Rhode, DBR, National Guard, and our municipal leaders. And we're taking seriously, but as I've said last night, it's not time to panic. One of the data points that we're closely watching is hospitalizations and hospital capacity. Our hospitals are at a different place than they were last year. For example, on December 6, 2020, we had 494 people in the hospital. This year, on December 6, we have 226 people. While we have the number of beds in the state to manage the hospitalization rate, we have far less hospital capacity given the nationwide staffing shortage and a staffing shortage that is here in the state of Rhode Island in the healthcare industry, from bus drivers to the healthcare industry. So my team is exploring any and all options to help build staffing capacity at the hospitals. This includes reaching out to our partners at FEMA to request additional staffing support like New Hampshire has done, and also exploring if there is a role for the National Guard to assist like Maine is doing. I was talking earlier today with Connecticut's Governor Lamont, comparing notes and making sure that we're keeping pace with what's happening in our region. That's why it's so important, as Dr. Alexander Scott reminds us, to seek medical care in the right setting and save visits to emergency room for truly emergent situations. I had conversations with hospital presidents this week as well, and we are preparing to act on a few of the items that they have asked for early next week through executive orders. So Rhode Islanders can visit www.health.ri.gov/right place and right care for information. That's a mouthful, but we'll post that up there to make sure everybody can get that. There was also early information out yesterday from Pfizer related to booster doses and their effects on the new variant. Our Rhode Island Department of Health team with the CDC continue to review and analyze the data, but the bottom line is this: if you're eligible, get a booster. And right before I came out here today, the FDA has approved the Pfizer booster shots for individuals 16 to 17 years old. So again, get that booster. And just as we set goals for adults to get vaccinated in the state back in the March time frame of 90%, which we will hit eventually, but we're at 96, 97% with one shot in the arm. We expect that 86% that we're at right now, fully vaccinated, will happen. But we're going to set goals, and we're in process of setting goals of what the percentage is in each age group, each category of what that booster needs to be. We need to really reinforce with people in the state of Rhode Island that not only short-term but long-term the boosters and the vaccinations are what I've put us in a spot today where we have a significantly less infection rate than we did last year at this time, as well as significantly less death rate than last year at this time. It's the vaccination, everybody. So let's get vaccinated. Let's get our booster. I want to take a moment to talk about testing here in Rhode Island. Rhode Island has consistently led the nation in testing. Our Department of Health has led the way nationally, and we want to continue on that path because we know testing is one of the most important tools that we need to use to fight the variant. The bottom line is this: testing turnaround times must get back to where they used to be. And I've directed our team to make this a priority. Right now, the Department of Health is exploring additional laboratory capacity and private labs. I have a call into the CEO of the company that actually is doing a good amount of the testing. I expect to be talking to him before the end of the day. We're taking this serious. It's crucial because we are seeing increased testing volume right now. We know that our main outside lab experiences mechanical issues that resulted in a delay that has been addressed. In a single day last week, we did more than 22,000 tests. That's good news. On top of that, a number of the nursing homes are experiencing outbreaks, and we are seeing a lot of cases among students. Outbreak testing for nursing homes at our K through 12 get prioritized, which slows results for the general population's test at state sites. I want to assure everyone that we are focused on the issue of testing. We're focused on the issue of setting realistic goals in terms of booster shots, and we are tracking the data and the numbers in an objective way that we can make good decisions, as we have since the time I've been the governor. So before I turn it over to the Lieutenant Governor, I want to provide a few housing updates. And as you all know, housing is a top priority for me, the Speaker, and the Senate President, as was realized with us having a joint press conference earlier in the week, along with our Lieutenant Governor and our entire administration. In the last 30 days alone, we've added over 220 new emergency shelter beds, and we are in the process of approving even more additional projects to shelter Rhode Island families and individuals through the winter months. This effort has been an all-in effort with my staff as well, which we coordinated because we felt as though that it was not going fast enough, and several weeks ago we made that coordination with, I see Secretary Pryor here, who's been involved in that coordinated effort as well, with other key people on our staff working with the providers to address this issue. On November 1st, we contracted to expand the hotel shelter program through the winter using an additional $4 million of FEMA funds. This expansion provides approximately 150 hotel beds for the hotel shelter program. And as I said on Monday, I'm committing to overbuilding the capacity as we did with our vaccines. We developed a vaccine capability for 100,000 shots in a week. What did that do for us when other states didn't? We got the overrun in terms of vaccine capacity, brought in like 100,000 shots over a short period of time that helped elevate our state to the highest vaccinated state in the country. So we're going to take the same tact here so that we do not have to deal with these same problems year after year where we don't have enough capacity as we enter into the winter months. So that way we can focus our time, 100% of our time, as we're all committed, I said earlier, to finding permanent housing options for individuals that want it and need it. And that means from homelessness to fair market value and everything in between, from low income to moderate income housing. We're in a position to do that, and we're committed to have a full plan to how to address that as a result of the work that we're doing on our Rhode Island 2030 plan. On Monday, I also said that we would have news soon about an appointment of the Deputy Secretary of Commerce for Housing, that position that was created last year by the General Assembly. I'm pleased today to announce that we've appointed Josh Saul as Deputy Secretary of Commerce for Housing. Josh is an experienced urban planner and affordable housing specialist whose career has centered around building more equitable, inclusive, and resilient neighborhoods. A native Spanish and English speaker, Josh returns to Rhode Island, where he began his housing career as a volunteer with the Housing Action Coalition of Rhode Island, conducting eviction prevention outreach to tenants and properties facing foreclosure while he was a student at Brown University. Josh returns to us from New York City's Department of Housing Preservation and Development, and he will officially start in early January. And I'm sure we'll make him very available to everybody, all the media, in terms of making sure as we introduce him at that time to the state, and he will be available for questions. I want to thank our interview committee. which was made up of our Lieutenant Governor Matos, Sharon Morris from our Omni Development, a nonprofit focused on affordable housing, Aaron Gornstein, former Undersecretary of Housing in Massachusetts, and current President of the Preservation of Affordable Housing, along with Mayor Maria Rivera from Central Falls and Secretary Pryor. As Commerce gears up to implement the small business initiatives proposed in my down payment plan, I also want to announce that we are appointing Hannah Moore, who currently serves as Chief of Staff at the Executive Office of Commerce, as Assistant Secretary of Commerce. In this role, Hannah will also implement federal grant opportunities related to economic development. Finally, a brief update regarding Rent Relief Rhode Island, which has been at the front center of our efforts directly with Rhode Island Housing. We've, in addition to communicating with them on a weekly basis, since we recognized that the money was not going out fast enough, letters going to the Housing Board as well, and interaction there. Our administration through Rhode Island Housing has distributed over $85 million to Rhode Islanders through the Rent Relief Rhode Island program. And I think this is important for us because there was some discussion about whether we were going to have money that was appropriated to us in the state of Rhode Island, whether we were going to be in a spot where we were going to have to give some of that back to D.C. At this pace, we are in good shape. We're going to keep on hitting the metrics that we are being given by the Treasury to make sure that Rhode Island benefits from the total $200 million in that program. So we want to continue to making progress on getting these funds out the door. That's why I'm reminding everyone, if you've already received Rent Relief Rhode Island assistance, you may still be eligible for additional help with rental payments for up to 3 months. We ask everyone to help us share that message. We don't want anyone who is eligible for rent relief when there's funds available to not receive those funds. So if you're out there and you feel as though that you have friends or neighbors that have been involved with the program, let them know that there's a way that they can get back into the program after a certain period of time. And if you're out there and your circumstances may have changed since April and you're having difficulty with your rent, please explore this with our office to make sure that you're receiving whatever assistance is available to you. Don't be bashful. Let's ask the questions and we'll get you the answers.